In assessing cranial nerve number 1, otherwise known as olfactory nerve, the nurse sprays a substance in a gauze pad. The nurse can also ask the client to smell other substances like coffee. This is to test if the olfactory nerve is working. The nurse asks the client to close his eyes and nod his head if he is familiar with the scent. In testing cranial nerve number 2, optic, the nurse asks the client to look at a certain point. Then, the nurse shines a pen light obliquely by the client's eye. This is done left and right. This test is to determine the client's pupillary constriction and pupillary dilation. The nurse then asks the client to stand up at a distance of 20 feet to read a certain set of letters in the Snellen chart. In testing cranial nerve number 3, 4, and 6, also known as oculomotor, trochlear, and abducens nerve, the nurse asks the client to follow the pen light as she moves the pen in different directions. This is to test the muscles controlled by the nerves in moving the eyes upward, downward, and laterally. In testing cranial nerve number 5, also known as trigeminal nerve, the nurse grabs a wisp of cotton and touches the client's skin, asking the client if she can feel the sensation. In assessing cranial nerve number 5, it can also vary from light touch, a sharp object, or a dull object. In assessing cranial nerve number 7, also known as facial nerve, the nurse would first ask the client to clench her teeth, then to close her eyes, to raise her eyebrow, to frown, to smile, and to puff her cheeks. This is to test for the muscle tone and facial symmetry of the facial muscles. In assessing cranial nerve number 8, also known as vestibulocochlear nerve, the nurse first stands beside or behind the client and asks the client if he can hear her voice or any other sounds like snapping sounds. Then, the nurse proceeds with hearing tests using the tuning fork, like Rhine's and Weber's test. In assessing cranial nerve number 9 and 10, also known as glossopharyngeal and vagus nerves, the nurse asks the client to open his mouth. Then, the nurse uses a tongue blade to see if the client's soft and hard palate has risen and also to test for the gag reflex. Also, in assessing cranial nerve number 10, the nurse notes the quality of speech of the client. In assessing cranial nerve number 11, also known as accessory nerve, the nurse first stands behind the client. She then places her hands over the client's shoulders and asks the client to shrug. This is to test the muscles controlled by the accessory nerve, like the shoulder muscles. And in assessing the last cranial nerve number 12 or hypoglossal nerve, the nurse first asks the client to protrude her tongue. Then, the nurse notes if the client's tongue is deviated to the left or to the right, which could indicate a lesion in the hypoglossal nerve.